Good afternoon, everybody, or good morning, and possibly good evening, maybe based on where you are located. I am so thrilled to welcome you to our event this afternoon. It is going to be a spirited and lively discussion separating fact from fiction in healthcare. I am very excited about this and thrilled to learn from our esteemed presenters. My name is Rose Cooper. I am an alum from the Simon School at the U of R, class of 2010. I'm also on the board of SWA and a member of our Global Women's Network Professional Development Committee. Um, Today is a collaborative effort between the Simon Women's Alliance, the School of Medicine and Dentistry, Women in Medicine Group, and the Women's Network. So if you are not hooked up with one of those powerhouse alumni groups, I suggest you do so soon. Run, don't walk to get there. As Sarah mentioned in the chat, we are recording today's session, so you can go back and get all those juicy tips afterwards. And we'll also be addressing questions at the end. So if you have a question that comes up throughout, drop that right in the chat, and we will go through those when we get towards the end of our discussion. I am really excited for all of you to hear from our panelists, and I am going to give them a little brief intro, which generally when I do this, this is where I start to feel unaccomplished and like I need to really think about my day job. So I am thrilled to welcome Amanjot Grewal, who is a graduate of the School of Arts and Sciences in 2011, and she earned her MBA from the Simon School. Amanjot, big ups. I didn't know that. She is the scientific director at Pinnacle Egg Bank and director of donor intake at Pinnacle Fertility. She's a recognized expert in embryology, focusing on cryogovernance, risk management, and the science behind frozen donor eggs. She's regularly featured as an expert speaker on fertility, donor egg journey, and lab safety. So I'm thrilled that we have Amanjot here. She brings a wealth of knowledge on a very critical topic. Next up, we have Ashley Hendershot. She's a board certified nurse practitioner at the Hereditary Cancer Screening and Risk Reduction Program at Wilmot Cancer Institute. And let me just say, when some of my colleagues found out that Ashley was on this call today, I was flooded with IMs about how fantastic she is in her field. So she has her Doctor of Nursing Practice degree from St. John Fisher, advanced certifications in genetics from the National Portfolio Credentialing Committee and Stanford University. And not to stop there, she's a member of the Collaborative Group of Americas on Inherited Gastrointestinal Syndromes, where she is on the Justice, Equity, Diversity, and Inclusion Committee, member of the New York State Cancer Consortium, New York State Genetics Task Force, and a peer reviewer for Oncology Nursing Forum. Last but most certainly not least, we have Robin Stutman, who graduated from the UR School of Arts and Sciences in 1987. She's board certified in internal medicine, infectious diseases, and hospice and palliative medicine. She has an MD from the University of Amsterdam and completed fellowships at NYU, as well as residency at St. Vincent's Hospital and Medical Center. With her experience internationally and domestically, Dr. Stutman has wealth of experience in a variety of topics, including wilderness medicine, humanitarian and disaster response, telemedicine, and event medicine. And this, I think, is very cool. Several years of service as the medical captain for the New York City Marathon. I need to hear about that, Dr. Stutman, maybe over a glass of wine one day. Now, what she does in her day-to-day is she works in an acute care ER setting for cancer patients. So she's described it a bit as the cancer ER. And she is part of the Memorial Sloan Kettering Cancer Center. And she specializes, as we said, in those oncologic emergencies. So I want to thank all of our speakers for being here today to share their time with us and their learnings. So we are going to start off. We know that this is about myths and misconceptions. So I'm going to ask, and Ashley, I'll have you start, and then our other panelists dive in. Why are healthcare myths so persistent, even when there's so much good science out there and so much more access to information today?
So I think the first thing that comes to mind is culture and connectivity, right? Those things that we kind of hold on to and feeling like we're holding on to these beliefs that are so set in who we are and make us feel like we're a part of a community. So that would be the first thing I think of. And then secondly, as a clinician, we're all very much prone to the anecdotal evidence, right? Kind of the confirmation bias that we see, even though that may not be evidence-based.
That's interesting. Amajat, what's your thoughts?
Absolutely, wholeheartedly agree with Ashley. I think when it comes to persistence, there are so many belief structures that are internalized from a really young age and people that you look to for feedback and guidance. And so by having those storied relationships, your community around you, and even new relationships, social media, you look to social media for a new fashion design, but in the same way that you're looking to it for what's cool in terms of clothing, you look to it for other resources. And so they feel persistent just because of the volume, the constant persistent nature of their presence in your day-to-day life. Just scrolling through your phone, you're constantly bombarded. The algorithm will feed you that over and over again.
Mhm. And as somebody who works in marketing for their day job, I love the algorithm and I hate it at the same time. So, Robin, bouncing off that question, there is definitely, this increase in available information out there. How do I avoid clickbait? Like, give me your tips. How do I know when I see an article being served up or I'm going through my, search results? What are some things that we can do to determine legitimacy of information and really help ourselves become those informed patients?
So I think that's actually a very big challenge because once you've had your question answered a certain way, very often when you're scrolling or when you're searching in other ways, you're likely to get the same answer, as I'm sure anybody knows. So I think one of the things I typically say to patients if I'm in that setting, or even friends who come to me, and I think we all expect that if we've even been to medical school with someone, I've had the experience where I don't realize that a friend who, for example, is a surgeon doesn't know certain things about other aspects of medicine. So it's kind of very pervasive. And so typically I say to people, try to look for articles, check with second opinions, see what experiences people have had who've done well. I think these are things that actually can help people sort of move away from clickbait and simply what's being served to them.
Mhm. Yeah, that's a great one. Um,
And I'll just
I,
chime in really quickly. I
yeah,
think
Amajad, go for
Robin's
it.
hit the nail on the head. Finding a subject matter expert, being a specialist in one space of healthcare does not mean you're a universal. The body has many complex and intricate different pieces. But the other thing I always, in talking with intended parents, is I'll ask them to look for the caveats, right? So not every healthcare solution is a one size fits all. And so when you're looking at it, who is the demographic that's presenting it? So, for example, in the fertility space specifically, someone that's 32 may have a very different prognosis than someone that's 42. And so look for the things that differentiate that person's experience from yours and use that as a lever for additional research and understanding and discussion.
Mhm. And a follow-up question to that, going with the idea of finding that expert in their field, um, are you as practitioners ever, offended or put out by a patient if they say, Amanjot, can you refer me to somebody who's a specialist in this? How can we get more comfortable asking those types of questions?
That's a great question. I would like to say that I'm never offended. Sometimes, especially when it comes to egg freezing, maybe I'll have a little bit of a hard feeling. But I think it's great. I think patients don't advocate for themselves. And anytime someone does a second opinion, a closer look, asking to have your provider, your current provider, even take a closer look is great. And I always encourage that. I think women, especially, for many reasons, without getting into anthropological review of society as a whole, for many reasons, will not only delay care sometimes, but also not feel comfortable speaking up. So I think as female providers in different spaces, the more we can do to have them advocate for themselves. And maybe I'm not the right provider for some patients, and that's okay too. Um, but Ashley or Robin, I'd love to hear your thoughts.
I'm a very big advocate of additional opinions. And I think that, especially in the space in which I work, which is cancer, where people really feel they have very limited time, I think it's very important that they feel fully invested in the people who are in their care team. And at times where people have questioned, I typically will respond, because that's usually the case, that they have an excellent care team, but that if there are concerns, they should pretty rapidly get a second opinion just so they can feel comfortable with the care that they're getting. And while I do think that that always sort of stings as a provider, I think that ultimately when most clinicians are comfortable with what they're doing, and if they're comfortable, they'll get over the sting pretty quickly and actually feel it actually improves the care relationship when someone goes elsewhere and gets the same opinion. And I think for the patient, that's very valuable as well. It can have a very powerful effect on the working care relationship.
That's awesome. So we should all write that down. That question, how you can easily phrase it is, just can we take a second look? Or can we just look at this a little bit deeper? I'm going to take that one away with me. So now, Ashley, I'm going to start with you on this one. And I think that this is a little bit of a fun one. Share what is the cringiest health myth that you've heard. And I'm not talking the things we heard in 8th grade health class, maybe about like hot tubs or stuff like that. But what's some of the cringiest health myths that you hear when you hear it? You're just like, oh, I wish that wasn't so persistent.
Can I tell you that I was in the car with my fiance the other day and he said, I have to stop eating eggs. I'm going to have really bad cholesterol. I think that's the one that's, talking to people about eggs are okay and they got a really bad rep for years. And I think another one that drives me crazy is, the myth of how infections are spread are still prevalent, right? That when it's cold outside, if your hair is wet or you take the baby out and put them in the car seat without a coat on, they're going to get sick. And so I think it's interesting that these things still exist and they certainly are cringeworthy.
Yes, with my 2 kids, I got a lot of stares sometimes at the grocery store if my kids didn't have coats on.
Yeah.
So,
Yeah.
Robin, what about you? The health myth that makes you cringe?
So I worked frontline during COVID, and there were many things going on. I'm sure everyone in the audience is aware of that. But I think the thing that I had really the most difficulty with was the story that ivermectin worked against COVID. And probably for me, the reason is ivermectin is a drug used for basically parasite. So as an infectious diseases doctor, I really had a hard time with that. But there are other things as well. And for example, in the cancer space, there are many different things that we hear about what will give you cancer or won't. I got a lecture from someone the other day about 5G versus 4G on your phone, in case that wasn't obvious. So there are many.
Mm-hmm. So I think go with the science. Amanjot, you're up.
Robin, I love your story. Funny enough, during COVID, I have 3 dogs. Ivermectin, the veterinarian that we work with, had a very clear disclaimer sticker, not for human consumption or use. And I had to ask, and he was like, I have to put it on there. I have to put it on there just to make sure that patients are not purchasing this, not for their pets' use. So yeah, that's a really good one. I'll stay kind of in the infertility space. 2 things I think are really pervasive and sad. One, that infertility is female source, that the woman is always a driver of infertility. And that 2, patients, individuals of a younger age, under the age of 30, can't experience infertility or don't experience infertility. Those are the 2 things that profoundly make me sad. And I'm actively always, wanting to talk more and more about.
Mm-hmm. Yeah, now those are thing again, go not to get too anthropologic, but goes back to, that sense that, if you choose not to have children or if you're not having children, you must have done something wrong.
Agreed.
All right, so now's the time we get to have a little audience participation. So Sarah's thrown up a poll for us. How comfortable are you advocating for yourself with your healthcare providers? So this could be, think of, the providers you see most often, and just pick the answer that you feel suits you best. And now, Sarah, you have to remind me, do we see the results when it comes up, or are you going to share with us?
I can share with you. I'm going to all right. Seems like we've got a good amount in there. All right. Do you see this?
Yeah, I love this. So we have
Yeah.
about 29% at very, 46% at comfortable, and then there's me in the somewhat group at 26%. So I am the heartened that nobody picked not at all. So that leads me into my next question, and I think we've all experienced this. You go to your provider, and it does not matter if you've been seeing them for a very long time. We still have this feeling that we need to be on our best behavior. And that sense of, I need to, like fold my clothes neatly, or, I need to make sure I look all together and not disheveled when I go and see my provider. How can we help overcome that? And then I think, when we overcome that sense of performative culture, it's going to help move me and my friends in the somewhat group up to that very comfortable at the top. I will open that to the floor.
I think it's understandable that everybody wants to look well groomed or well put together when they go to the doctor. And I think that's completely, I do the same. I think that maybe people should use that and say, okay, well, I've done that now. And I think a really useful thing to do, very old school, but it works, is to have a list of things written down or on your phone that you want to discuss, and maybe prioritize them because your provider may not have time for all of them. And then if you get through those or a certain number of those with your provider, say, I still have some questions. Is it better if I put that in the portal? Would it be better to make another appointment? What would you recommend? I think a little bit of mental preparation, even if it's, 10 or 15 minutes right before the appointment, actually can go a long way to just, a few deep breaths and being able to talk to your provider. And I think dressing up or grooming or whatever anyone wants to call it actually just acts as letting you be comfortable. And then there's room for the rest.
That's great. Actually, how can we bring up maybe sometimes increase those taboo topics a little bit?
Yeah, so I think one of the most important things that I find valuable is the use of direct language. So just speaking your truth, your mind, the language that you want to use and not skirting around it. I think the more direct you are, the more likely you're going to get the answer to the question that you're intending to ask. And so maybe opening with, kind of shying your way into the conversation, but saying something along the lines of, I have concerns regarding my intimacy, and just kind of opening the door to have that direct conversation about maybe something that seems more taboo than, the typical, how's your nutrition? Are you exercising? Those types of conversations.
Mm-hmm. Amanjot, what about you? Because I feel like in your field, you by nature probably talk a lot about taboo topics or things that we feel are taboo ourselves, even if they're not.
Yeah, absolutely. I think there's a lot of stigma that surrounds fertility, both male and female. I think my two recommendations are, if you have a provider that you do not feel comfortable speaking with, potentially consider changing your provider. And if that's something that you're open to and able to do, it's really important that you find someone that you jive with, that you really are able to share. This is your care, this is your health. And you want to make sure, like Robin mentioned earlier, that you have a true partner in that. The second piece that I'll just say, for those that may struggle to put their thoughts together, what I've gotten a lot of recently that I love is patients will proactively in our portal send a couple of thought points of like, hey, I really want to talk about these two or three couple of things. And I think that's really great because one, it allows me as part of your care team to kind of mentally prep, maybe review your chart under the lens of, I don't know if you have found that sometimes the question is, I need to look and I'll get back to you. So it allows me to kind of do some pre-work leading into that consult and that conversation. And then second, it helps me kind of frame where you're at headspace wise. I think, especially speaking of the fertility journey, but regardless, whether it's oncological care, whatever it may be, it's really important that your care team kind of meet you where you are at today. And of course, your questions may shift prior to the consult, but actually we proactively we do a lot of texting through our portal. So we will proactively text usually about 48 hours before and say, hey, your appointment's coming up, reminder, but if there's any questions that you have leading into it, please send it to us. And that gives us some lead time to really make sure that the time that you are dedicating, whether you come dressed to the nines or you're wearing sweatpants from yesterday, I really don't care, but I want to make sure that I address what's important to you during that visit. So advocating for yourself in whatever means is comfortable. I love the idea of the list. I love the idea of pre-work. Some people struggle to articulate on site, and so having the chance to put that together in advance is so critical. But again, if those things, that pre-work, that on-site conversation, are not meeting your expectations, you dictate your care journey. And so you really, this is when I think it's a great opportunity to get that second opinion that we talked about earlier.
Mhm. Yeah, those are such important points. I often think, I need to remind myself that this is, my appointment, that I'm scheduling for my needs. And I love all those tips. So, if you feel comfortable talking about it in person, if it's easier, I want to put it in a message before, so I'm not, feeling like I'm catching my provider off guard. I think that's great. And just like, I like to prepare for a meeting here at work, I can do my part to help my provider prepare to help me. So these are really great takeaways.
And I just wanted to chime in and say I thought the points that were made by Amanjot and Ashley were great. I think because there's some more coming through the chat that it's very important just to reiterate. There are physicians who may not have bedside manner, so to speak, that makes everybody comfortable, and it becomes a patient choice. I think in general, with physicians you depend on, it's important to feel comfortable. But I do know regularly, and also from personal experience, that I've sometimes continued with clinicians who are perhaps not the coziest, but they know how to take care of me. And so I think that's kind of a trade-off at times that patients really need to make for themselves. I think it's a question of, are you being heard?
Mm-hmm. And I think that's great. Great to think about. So looking at, sort of some stuff we've talked about before, how have you seen over the last several years just attitudes shift around topics in healthcare, things that are becoming more out in the open overall? The one I often think about is menopause, which I feel like 10 years ago was a bit of a dirty word. And now it's, I can't open up my social media feed without getting served an ad about better sheets or a supplement or XYZ. So what are some of, the ways that you've seen the influence of media help shift our attitudes on healthcare and maybe some of the pros and cons there?
I think it's so funny that you bring up menopause. My grandmother, will still cringe when my sister, myself have that conversation, and my aunt also. I think they've gotten better. We've desensitized them a little bit. And I think that's good. I think that's great for a lot of reasons. It's great to open the door. And I think it's great for those that are starting their journey. And I'll speak for the fertility space, but for those that are interested in starting their journey, it's a great gateway to get a feel for some of the language experiences that patients have had, other patients have had. I think this goes back to a little bit of some of that myth conversation that we were having earlier. Again, not one treatment plan nothing is one size fits all. But I think it's a great way to at least destigmatize and make it accessible and make sure that that language is something that you have a resource that becomes part of your vernacular day to day.
I think it also is, posed this trend towards owning your own health, watching other people's journeys, as Amanjot mentioned, now we feel more in control, maybe about talking about these symptoms, normalizing the treatment and management of these things, and it not being such a taboo topic anymore. Not just this topic, but other topics as well.
Are there topics that you ladies come across that you wish could have the glow up that menopause is having, where they're coming out more into the vernacular and getting talked about in a more robust way?
This is on the male fertility side, but just anything male fertility. It's so interesting. Same-sex male couples, very open, great dialogue, lots of online presence. Men in a heterosexual relationship, very limited conversation and dialogue about what that fertility journey for them looks like. So I would love for them to have a glow up. I love that. That's a great way to describe it. The ability to speak more freely. I have to date seen very little, if any, content about that space.
Mm-hmm. Yeah.
And I'll piggyback off that, Amanjot, by saying hereditary cancers for men, right? There's always been this attachment to the hereditary breast and ovarian cancers, females. But I'd like to glow up the effect of cancer genetic testing and the impact on families and how that impacts males as well. or those assigned male at birth.
I think I have something tangentially related to both of what both of you have said, which is I'm hearing a lot more about actually intimacy on the male and female side and things that affect that at various stages of life. And I think that's something that maybe I'm not sure how much it's really out in the public yet, but I think that's something that becomes when you hear how it's impacted people's lives. I think that's something that could do with much more public attention, so to speak, because it has really positive effect.
It does. Switching gears a little bit, telemedicine, which for me feels very new, growing up in the age where you see your provider, you go in person, you make an appointment, versus, I think some in the younger generations are, I'm totally fine doing telemedicine with an online provider that I've never met before. What are some of the things that we should watch out for in telemedicine and possibly even some of the misconceptions that we might have heard?
I think there's a belief that you're not getting the same level of care via telemedicine as you might be in person. And, I think there's been a huge shift in the paradigm, the way we give healthcare, right, in terms of a physical exam. And so for people who live some distance away or it's difficult to come to an appointment, I think there is this misconception that it's not as great of, like they're not getting the value that they would have in an in-person visit. And I think we need to shy away from that and really have the conversations with patients that we would do pretty much the same thing in the exam room. So I think that's one thing that has come out of this.
Mhm.
I think also, I implemented and I ran a program at Sloan for a while that was a remote triage program. And I think if you work in a large institution, there's always the feeling, patients have the feeling the care is going to be better there. And there are certain things that are obviously in a tertiary center are better. But I think if you're acutely ill, you need to be seen where you are. And so, similar to what Ashley said, we had that hurdle initially. But I think patients saw over time, we had a lot of very good outcomes, and patients saw over time that that was very helpful. And I will give the flip side as well, because we had all ages. And what we noticed, and I think it's a trend that's well known, is that people who are younger and who grew up with a lot of technology had the question often, but why do I have to come in? I can just talk to you remotely. And I think most of us in the telemedicine space believe that hybrid works the best. So it's really important to know your patient. It's important to be able to examine them in person at times, but there are many things that can be done remotely equally well as in person.
I think that's so great, Robin. The example that I love giving is mental health. I think by being able to speak to a mental health provider from a comforting space, whether it's your home or somewhere else, I don't know, has made it so much more accessible than traveling to an office. I think there's something to be said similar in the fertility space where there is a stigma. You walk into a fertility clinic, it's branded X, Y, and Z fertility clinic. And that can be really scary and not a pleasant experience for a myriad of reasons. And so by being able to access or at least start your consults when you need on-site care, like a procedure or acute, obviously you need to be on site, but it's allowed a lot more intended parents or patients in the mental health care space to access care from a comforting space. And I think that's great.
I feel like nowadays I see a lot of the rise of unaffiliated telehealth services. So for example, I'm old, so I'm on Facebook. I'm not on the gram or the TikTok like these young friends, but I'll see a lot of telehealth, those, or like digital health partnerships is how we often refer to them in my marketing world. And when we're evaluating these as patients and possibly even considering some of those services, are there any things that should be like watch outs for us or things that we should be looking for specifically?
I think that if one of the things I tell patients is that in general, if you don't know a clinician at all, and you are connecting with them in an acute moment, that may, when you're most ill, that's actually a time that's good to go and be seen in person. There are, I think also that when people want to simply prescribe, they're talking to you for 5 minutes and they want to prescribe a medication, and you feel as though maybe you haven't been quite heard. I think those are situations that people really do need to watch out for. It's different when you're dealing with a care team who knows you and has your background, and after 3 minutes of conversation says, oh, I know what's going on, let's do this, and then we'll see you in follow-up. So those are two very different situations. And I think with an unknown provider, you do have to be careful. They may be very gifted, but I think it's important to be careful that it not just be, oh, you're getting in touch with me, I'm going to give you a prescription, I'm going to refer you to a different specialty, things like that.
I would also say caution on the financial piece of that as well, because some of these aren't taking, insurance, your standard insurance. It might be more of, what we've seen the shift in primary care to maybe more of a concierge type of medicine. So just making sure that it works with your lifestyle, with your finances, and what type of coverage. And I would be cautious about things that they don't want to run through insurance and do at a cash price or through unconventional, pharmaceutical prescribing as well.
Mhm. Yeah, that's interesting. I think probably we'll open it up. Sarah, you want to open it up to Q&A? Anything from the audience? I did notice there was one question that came in around, bedside manner and, how is there, I think just a curiosity from the group, like, is there training around bedside manner or patient relations? And, maybe if we're working with a provider who, we love the care they provide, but their mannerisms are a little off-putting, how can we help, share that feedback? I have a provider like this, like I love him, like love him, but he's not like always a warm and fuzzy.
I have a slightly different background because I chose to train in Europe instead of the United States. And we had a lot of training. We, as part of our training, we were in small work groups. And once a week, we had some kind of training that pertained to bedside manner or direct patient contact. One of the times, just as an example, we spent, I think, an hour and a half thinking of all the Dutch words for the male and female genitalia. And everybody had a great time because, of course, I didn't know them all yet because Dutch was new to me. And so the idea, though, was I thought very good when it was explained that you need to know the words because it's really up to the clinician to meet the patient. We may have certain words that we don't really feel comfortable with as clinicians, calling, the penis and the vagina, but all the other words that come up for that. But if a patient is talking to you and using certain words, they will be more comfortable if you are able to use those words with them and meet them in a way that just makes them feel comfortable. So we had a lot of training with that. I'm not sure that just the training, I think it's also the personal investment. I think it's everything because I'm not sure it's always also a question of making everything, and I don't mean to offend anybody, but making everything warm and fuzzy, but really being accessible and letting the patient or the person who's in the patient's seat feel comfortable telling you whatever they need to tell you or talk to you about, and really meeting them on that level so that they feel they're able to discuss things that even if they're uncomfortable for that individual.
Mm-hmm. Robin, I think that's a great reminder that you had at the end. Like a provider is not your best friend. They're a professional, and think about what works for you. Do you want somebody that's maybe more on I'm a little less warm and fuzzy and I'm more just over here, or find somebody maybe with a different style that will work for you better. That's great. So this might be a little bit of a controversial question, but we had one come in around detox diets, detox supplements. We've all seen the ads. Are those actually beneficial? Should we even be like, should I just keep scrolling? I'm seeing
Please
some
do.
smiles, Ashley.
You have a liver and you have kidneys. If those are functioning, you don't need to detox.
All right, we heard it here. Your liver and kidneys are your body's natural detox. Um, this is one that came in where as sometimes we age, we get, aches and pains. And how can we tell whether or tips, because I know we're not in a clinical setting here, but what are some ways that I can recognize, maybe this pain is because I pushed it too hard at the gym yesterday and I'm getting a little bit older versus this is something that I need to call my provider about and get addressed uh, overall.
I think pain that is lasting, or certainly some pain that becomes constant, pain that prevents you from doing your daily activities, pain that, I think if you go to the gym and you overdo it, you might have pain for a week, but it really should go away, especially if you rest. So pain that is unrelenting, worsening, or preventing you from daily activities, I think are things that should prompt a call to the clinician. And we have people who come in after a year and we say, well, why didn't you come in earlier? So that's a bit long, but I think waiting a month, a week or 2 weeks is reasonable. And then you can take a further look with your provider.
Mm-hmm. That's interesting. Here is one that I'm also interested in. I feel like I'm interested in them all, but we've all heard the benchmarks of get your 10,000 steps a day, drink your water, have all your proteins, check your macros. How important are some of those benchmarks? I feel like I've heard my entire life get 10,000 steps a day and drink 8 glasses of water, but what's really important for us to think about when we hear those types of phrases?
First off, I think one of my pet peeves is that we all hold ourselves to these standards. And really, if you shoot for the moon, immediately, that's not how change is made in a way that it's changing, like going to be life changing and habitual. And so I think, first of all, when you see those things, just meet yourself where you're at. I tell this to my patients all the time when you're thinking about lifestyle is you may not be drinking, and 8 glasses a day is totally not correct. It's, based on your body weight and a lot of other factors, but just drink more water, right? Add more water to your day. In terms of exercise, I don't want you to start if you've only been walking 1,000 steps a day to go to 10,000 tomorrow, but maybe take an extra lap. Work your way up to it, and that's how big changes are made. Add a salad to your, day, your week, just one small change at a time. Because I will say these things that we try to hold ourselves to it's kind of impossible.
Mm-hmm. So I'm going to direct this question your way. It feels like, as time goes on, we see all these, breakthroughs that are marketed. And we feel like I see a lot of them in the diet space of, like keto and this and GL1Ps. But then we also see them in the fertility space of, this ovulation tracker or eat this cookies to make your breast milk come in better, or, make sure you're standing up on your head when you're being intimate with your partner, with your leg beside your shoulder, because that's what's going to make you get pregnant. How can we sort through like the marketing myths that are in the industry and then really dial in on figuring out where the evidence is?
Yeah, that's a good question. I think there's marketing. I give kudos to anyone that works in marketing. That is so compelling sometimes that truly I sit there and go, well, maybe. And then I have to go, okay, hold on. How much is it? And that usually is the ultimate deterrent. But I think you're spot on. It's a great question. There's a lot of conflation of what's called lifestyle products and health and wellness products versus things that are FDA approved and have gone through essentially rigorous clinical trials to then be made available as technologies in the health space. I think as a consumer of all things TikTok and social media, it is really hard. And I think that that's when we fall into this clickbait habit, right? We were clicking through, we're reading through everything on that website. That promotional material is so compelling, right? That it's always 110%. Nothing is ever even, 90% success. I encourage us to, one, do some due diligence, move away from that website, look at outside resources. But I think this is also another great way to use your provider as, and I will get common questions, like for example, CoQ10. Do you recommend CoQ10 for me? And that allows them to look at your whole health history and really see. Now, I don't ever recommend detox teas. I'm so glad Ashley shut that down and reminded us that we have livers and kidneys that are high functioning, I hope. But that is really hard. And Rose, I don't know that I have the best answer other than I think this is when we leverage our own ability to do research. And that's when we leverage our provider team before we implement any of these things in our day to day. I have found, unfortunately, sometimes these products are more deleterious than they are helpful. And they can help validate or provide an alternative. So, for example, you mentioned like ovulation kits. There are quite a few OPK kits that are FDA approved and are commercially available. They're not as sexy packaging potentially as the one that you've seen on marketing ads, but I think that's a really great way to leverage some of the different vendors that your provider team has and your care team has already vetted.
Mm-hmm. That's an interesting answer. Thank you. I work at an agency where we do a lot of pharma and healthcare marketing, and I have a client in pre-FDA approval right now. So you're speaking music to my ears about how hard and strenuous it is. All right, this is a really interesting one, and I think so beneficial. How can we approach conversations when we disagree with our provider? Whether it's diagnosis, treatment plan, and maybe not necessarily, like big items or small items, maybe not where it's, you want to get a second opinion, but, it's your doctor said like, oh, that might not really be a concern. Or I think we might have all heard before, like let's wait it out and like see. So how can we really help in those conversations, or what tips do you have for us?
I'll have a lot of patients that will request a second meeting. I think sometimes it allows us, again, this is why I really love the idea of pre-work. It allows you not the ability to be reactionary in the information you're sharing, but they'll ask for a second meeting and list a specific concern that they have. And that allows me the opportunity to maybe, again, kind of see where their headspace is at. We've talked about language that patients use. For example, recently, there was some conversation about general anesthesia versus twilight anesthesia, which is also called conscious sedation. It's also called it's called light general anesthesia. So there's so many different nomenclatures, and so a patient will send a message, and it allows a second opportunity to address and either reaffirm kind of your understanding of their concerns, or potentially to pivot if that makes the most sense. Again, it's your care journey. So if there's questions that you have or something doesn't sit right, or like Robin mentioned, this is an ongoing persistent pain point, speak up. It's not just encouraged, like this is your body, your life. And so you really need to speak up for your care and allow that second review.
I think too, it also depends a bit on your setting. I work in a very fast-paced setting at the moment, and often we do have patients who say, I'm not going to accept that. And I think part of what's interesting about medicine is learning about people. So, especially when somebody really needs something and I know they need it and they won't accept it, I sort of turn the question on them and I say, well, why not? What's going on? Or the family. And for me, it's an education sometimes in how people see things they've heard, things they've learned, things that have happened to friends or family members. And I think that's the only way as a clinician. I do think, this is not all about what you need to do as a patient. Clinicians, doctors, MPs, everybody, we have a responsibility to take care. And that means that we do need to be interested in our patients. And I think this is one way of doing it. And I think as a patient on the flip side, it's really okay to say, you're not listening to me. This is my concern. And in my setting, it would be more likely just because we don't have a lot of time. Things sometimes have to happen quickly. And I've had patients say, this is my concern. Can you tell me about that? And I know that they're not going to accept, whatever, a presser or a test or whatever. And so I take the time. It doesn't actually take a lot of time if people feel they're being heard. So I think there's sort of that give and take on both sides. And I think it does require in a longer term relationship, I think hopefully there's more time to develop that back and forth interaction between patient and provider.
Okay, thank you. Um, so I think, myths, misconceptions, I've made a lot of references to the ones I see while scrolling, but there's also a lot of myths and misconceptions that we see on the news or even really at all levels, sometimes of leadership. So we're seeing a lot of distrust in the community, for topics like vaccines or, other things like that. What can we do as informed patients to make the best choices for ourselves and our families when we're just really getting differing information across all channels?
So I again, I think it's the same thing. I think it's a question of asking many, not just asking one of your clinicians, maybe asking all of your clinicians. For a long time, it was not considered good practice to talk to your patients about what you did for your own family or what you'd recommend. But I think as things have developed through the pandemic to now in vaccine science, I think it is increasingly facilitating actually when I talk to patients and say, well, for my own family member, I did this for this person. There are some concerns. There's some family members with cardiac disease. So, we looked at this. But I also tell them that I get my vaccinations. And, I think part of it now, it is a question of, because there's such distrust with vaccination, it's hard to read through all the trials. It's hard to know all of the potential, because for certain people, there are reasons not to give certain vaccines. But it's true, the current environment, it's very difficult to navigate. And so I usually encourage patients not just to listen to me, but to go talk to a variety of their providers, make sure that all their different specific health concerns have been looked at with regards to vaccines or their children, if it's about their children, before they make a decision about getting vaccination. And in general, I explain to them what the benefits of vaccination are. And as you can tell, I'm fairly pro especially because I worked during COVID, and that's not to say that I agreed with all the different formats of the vaccination, but having worked frontline definitely made us all think about vaccination and what we thought.
Mm-hmm. Where is a spot that you ladies would recommend, for us as consumers to go to for reputable information that's going to be easy to understand? I know we've mentioned like you're probably all very well versed in being able to read the, New England Journal of Medicine and read the scientific reports. But for us as consumers, are there places that you recommend where you feel confident that we'll be getting good information to look? And I'm not talking about Dr. Google or Dr. ChatGPT.
I really like several of the science sections. USA Today, for example, had a very good science section for a while, and I think still often has very good science. I think Wall Street Journal sometimes. I think some of the major publications, especially international ones as well, where you have access to what people are thinking and doing overseas as well. So you can kind of compare. I've found those to be fairly helpful to people. Mm-hmm. And they're in every day-to-day terminology.
I think Robin's spot on with language. There's a website called Open Evidence that I feel like a lot of my patients have been using. And what I love about it is it'll link to the study, and actually it'll prompt some really great conversations about how generalizable it is. So what you're reading, are you part of the patient population that was included in that study? And I think it does a really good job of making it lay, but having very clear citations.
I apologize in advance. Oops, sorry. Please go ahead.
I was just dittoing that. I've been telling patients to use Open Evidence a lot recently too, because it's such a great explanation and easy to read.
Okay,
and I'll be the skeptic, because I do just want to let the audience know, in case they haven't found that out, that with like most AI sources, you need to really make sure you can find the article and that it really exists. Even OpenAI can sometimes hallucinate. So I'm sorry, but just.
No, a great disclaimer, Robin.
No, I think that's a great disclaimer. I will also add, we have clients that advertise on Open Evidence. So also just realize that there is sometimes marketing on those scientific platforms as well. So, but yeah, I haven't heard of Open Evidence being used for patients before. I'm going to take that one back here. Alrighty, so we are going to be wrapping up here. This has been such a spirited discussion. So for our three panelists, if you have to have, I'll have each of you respond. What is just one thing? If we only remember one thing from today, what would you want that to be as we close?
I guess I'll start. So I think one thing to remember is you're not bothering anyone. You should not be feeling like you're taking up anyone's time. It's your healthcare, and you know your body better than anyone on this planet. And so you should feel empowered to share when things don't feel right or if you have questions or concerns. If you feel like you're bothering someone or this is not something that they want to, that you're not being heard, I think you need to question that.
Mm-hmm. Right. Amajot, what do you think?
I liked Ashley's a lot. I wish I had gone first. I think the one thing that I would share is as you move forward and as we evolve as a group, to start thinking about stigmas that exist in different healthcare spaces and see if you're willing and wanting to proactively start some of those conversations and dialogue. We talked about menopause a little bit, but having those really open, honest conversations with your mom, your aunt, your grandmother, your sister, the women in your friend circle, your neighbor, just to make sure that we create community and we allow each other to have that language in our day to day. I think that helps so much as we then go to our providers. It's a word that we've said, we've said vagina out loud and we feel okay saying that. And I think that that's so, so important, how we can start destigmatizing these things.
And Robin, take us home.
These were great suggestions, and I'm not sure how much I have to add. I think one of the things I would say to people is that if you, for example, are in a setting and you notice that somehow you don't feel comfortable and it's not something, even if you try some of the things we've suggested and you still don't feel comfortable with the clinician who's in front of you, feel free to go get a second opinion or even a third. I wouldn't go get 10, but I think people should feel comfortable to go ahead and get a second opinion and see if they either find something that makes more sense to them and works better for them in specific, or if they actually find out that it makes it, in retrospect, their clinician understood them very well from the beginning and was doing exactly what they needed.
Mm-hmm. That's great. That's great. So I want to thank Amanjot, Ashley, Robin for joining us today for this incredible, incredible program. I am just bubbling with information and I'm excited to bust some myths back in my own household when I get there as well. Sarah has put information in the chat about all of our upcoming UR events that are happening, as well as the alumni groups we mentioned at the start, Women's Network, Simon Women's Alliance, and the Women in Medicine and Dentistry group. We are going to be distributing this recording after the call, so if you missed it or perhaps have a fellow colleague you'd like to send it on to, that is great. Hope that everybody has a fantastic Thursday. It's Friday Junior here, so have a great rest of your week and weekend. And as always, Meliora. Thanks, everyone.